Hi, everybody, and welcome to this very special episode of Preventing Decline. Today, we have a special guest, Joan Harris. Joan is with us. Joan has a long career, a long history in working with older adults and always taking the approach of how do we prevent decline, which we talk about all the time on this show, but her methods, her process, her education, her training, everything she does is about empowering adults for not only planning to maintain their own independence, but with their loved ones. And so we are honored to have Joan with us today. Joan, thank you so much for being here.
Thank you for having me. I'm so glad to be here.
I know you've been 40 plus years working in this industry as a case manager, care manager. You started to correct me right before we hit record when I said case manager. So let's just start right there with what are some of the differences? Because I think there really is a lot of misinformation out there when it comes to, who's a case manager. And I don't think anybody gets a good vision in their mind of like a case manager who's working with 50 patients and doesn't necessarily have the time, because it certainly sounds different from a care manager.
Yes, well, thank you, because there is a lot of confusion about terminology out there. We hear that all the time. So my professional term is I'm an aging life care manager. Years ago, our association, we were called geriatric care managers. So a care manager is a private consultant who works for the older adult in any setting. So they are our client. We are nationally certified by the Aging Life Care Association, which means we live by a code of ethics and standards of practice. It's a very high bar. We're the only outside objective advocate for the older adult, no matter who hires us, and we can never benefit from any referrals that we make. So we are hired privately to do an evaluation, to jump into a situation, bringing many years, and we all have different backgrounds of expertise in the field of elder care to help guide people to reach their goals, which is going to be different for everyone. A case manager, we think of insurance company case managers who are managing utilization review and how services are being, purchased, as well as case managers in acute care hospital settings who are doing discharge planning. What's important to understand is those are vital roles, but they don't work for the older adult. They work for the institutions of which they are employed. Doesn't mean they're not caring people that are trying to do good work, but we're that outside objective expert. And there are 1,700 of us across the country.
Wow.
And in New England, where I am, there's over 200 aging life care professionals.
So this is very interesting because I really don't think enough people understand the role of a care manager and the fact that this service is even available. So if we could just sort of back up for a minute, like what is the goal, or maybe I should say, what is the why of an adult care manager? Who would look into something like that? Do you wait until you're a certain age, until something goes wrong? Like, tell me more about it.
So first of all, I love that question because there's so many vital parts to that. So first of all, I'm a social worker by trade. Many care managers are social workers, nurses, physical therapists, occupational therapists, and now, in an exciting way, expressive therapists, as we start to really look at providing engagement and meaningful activities for people in their homes and in their lives. So as a care manager, my goal is to have no agenda. Each individual client and family system is reaching out to me, typically the adult daughter or son or family member, when they're stuck and things are really kind of a mess because there's been no planning. Mom and dad are in their home. Dad has Alzheimer's. Mom has physical ailments. They refuse help. They won't leave the house. Help, what do? We're pulling our hair out. So as that objective outsider, we're going into the home, we're building an alliance with the older adult, we're doing the assessment and making recommendations and empowering the client and the family to make really good decisions because they now understand what is available to them and the systems. Navigating elder care is so difficult and it's worse post-COVID. So then what we can do once we've provided those recommendations, because we are not decision makers, we're strictly consultants. So the healthcare proxy is oftentimes the one that we're interacting with, but we're always focused on the older adult. So once we do the assessment recommendations, then we're having conversations. What are the pieces you need from us? So for example, we have many clients whose children or families or significant others live out of state. We're taking our clients to doctor's appointments. We're going to the emergency room. We're advocating for them. We're assisting with making recommendations for building in the layers of support in the home to help them age in place if their goal is to stay at home. We're monitoring those services. We're bringing to them our best vetted jewels of providers that we trust of all different types. So we are essentially building that elder care team, coordinating it. We're not always the doer. We often are moving people to assisted living, retirement living. So it's all, we can do all those pieces, but we're only going to do what a particular client needs from us, and that can change over time. So to answer your question, interacting with a care manager to get a plan in place, the sooner the better. Don't wait to be stuck and in the mess. So I now have this planning program specifically because of my passion to get to people sooner so that we can avoid so much of what we see in our day-to-day care management practice.
And I think that's why I needed you to come on the Preventing Decline show, because I get it. I understand now sort of the vast majority, which is, I mean, look, our healthcare system is set up to be reactionary. When you're sick, you see a doctor. After a fall, you go to the emergency room. Once you are diagnosed with dementia, then a plan is in place. What my mission, and I know that you're aligned with this mission, is about preventing decline. And I've seen it with my own mother, wherein what we've tried to do she's in her mid 70s, but what we've been doing for the last 15 years is planning, whether it be financial planning, all sorts of plans are in place for the what ifs. And that's not the way most people approach this. And I know that this is where you're really trying to push, because I'm sure you believe you can be even more effective if you got in, at the ground level with people before they got sick. So tell me more about your preventative services, if you will.
Right. So I think because I have a number of years behind me, that kind of my superpower is that if I collect information about people, their diagnoses, the medications they're on, who's their support system, I can go into their home and talk with them and understand where the missing pieces are and hear from them what their concerns are, but also to do some visioning exercises with them to help them to kind of say, okay, I kind of had a sense of what I want, but now I'm doing a deeper dive into really what I want. So what I want, for example, might be my husband and I want to age in place at home. We've put in some grab bars, we've done in this and that, but both our kids live in San Francisco. We feel anxious. What if one of us gets sick? So they get what I call all the keys to the kingdom. Here are my best vetted resources of what you would do in X, Y, and Z situations. Here are all the supports that you would need: phone numbers, pricing, contact people if A, B, and C happen. And here's how you can age in place, as well as if you would like to have us kind of available if there is a change in your status, we can be here for you. So that provides them with this feeling of security that if things change, God forbid, I'm alone in this house, I can call Joan and her team can come in and make sure that I have what I need to feel safe and secure and take care of my healthcare needs. So we can provide them with all sorts of options of resources and services they have never known about. For example, maybe they don't need a caregiver who's a CNA to provide personal care. Maybe if they're no longer driving because low vision, then there's a companion, a high-level companion. Oh, I never knew that was available. Here's what they charge. You only need a few. You don't need to book a long shift. You can have 2 hours. So enlightening people that they have options and supports. And then if they need us to help coordinate that, they know we're just a phone call away. So we provide this plan for them. But at the same time, we're doing the plan for aging in place. We're talking about that backup plan for when and if home is no longer working. Because what we know is people cannot educate themselves about their options in the middle of a crisis. So the time to do the planning, like you just said you did, is right now when they can take the time to really understand what is a good fit for them. And I'm going to guide them to knowing them, meeting them to a particular community or 2 communities that I think, for example, this couple I met with last week, they love to be outdoors. She has chickens and she has a huge garden. So there's maybe a particular retirement community where she could be in a cottage and she could have her garden. That would be really important to her. So really understanding all the pieces around a person, the financial, the health, the cultural, all those factors, and then understanding what's available and making that fit for them makes it more manageable for people to have a plan and take their time to really evaluate and understand what's going to be helpful for them, knowing then that we're a resource for them. If everyone had a plan.
It's right. Then, I'm sure you're familiar with this term. It is person-centered care.
Yeah.
Which is very different than just, something happens, you end up in a hospital. Again, great people, but their job is to, keep you alive or just take care of you acutely. What you're talking about, at least in my head, sounds like a roadmap to successful aging, a roadmap to dying the way you want to and seeing your life through the way you want to. I love that example of the woman who wants to be near outdoors, who wants to be, maybe near a farm, like with animals. That's very different. I can tell you this, back to my mother, that's not something for my mother, probably because my family were born and raised in New York City. So that's not up her alley. And I think that's where, that custom, dare I say, personalized prescription comes into place, that just not enough people realize that there is this type of service out there.
There's another couple that I did a plan for a year ago, and I got a call from them a few weeks ago. And when they called me, I went to the emergency room. I had been in touch with them on a regular basis so that I could then be credible and ethical in understanding what their updated health information was. But essentially, it was an inappropriate discharge that was happening. So then I can put my full care management cap on, put up my hand, stop the discharge, make sure there's a good plan in place. So to give people peace of mind that not only do they have a plan for their aging in place and living their best life, but also to know that there are people who have the knowledge and understanding of how to navigate the healthcare system so that when a crisis does happen, then they can pull in that expertise. Every care manager across this country is well-versed in navigating the systems in their particular geographic area. So building the relationships with us as a profession as soon as you can, even if you don't need a lot of service from us, it's building that trust so that when things start changing, not only do you have a plan, but you have a support system. So that's what I would love to see.
I know that you were working, for organizations most of your sort of adult life, but now you've really transitioned into more of, it sounds like a private practice. if you will,
Yes.
right? Your own company. So people that are local to us, which I mean, you and I are both in Massachusetts, where would they find you and your team? And what does that team look like? And then nationally, because people are going to listen to this all across the country,
Mhm.
where would they find a care manager to set up their personalized aging plan?
So thank you so much for asking. So my small and mighty company is in Metro West, Massachusetts, and we cover Greater Boston and Metro West. We refer to respected colleagues for South Shore and North Shore of Massachusetts because my own personal ethics, and every care manager comes to this and approaches it differently, is that I don't have the relationships on in other areas, then I can't truly serve people, and I also need to get to people. So as I said, every care manager is different. We cover Greater Boston and Metro West. The planning program I can do any place in Massachusetts because it's a plan and it is then offered, and then we can connect them if they do need care management services more locally with our respected peers. We have a very close-knit, robust community of care managers. So the Aging Life Care Association is aginglifecare.org. You put in a zip code and you can find a care manager any place across the US. There are gaps. There are some areas of the country where I've always offered to colleagues, financial advisors, wealth managers, elder law attorneys, and many other types of partners that I will find them a care manager. And so, you know, you do sometimes have to dig in areas where there might be a gap, but usually we can find a professional. But it's a very large, qualified community of care managers across the country. In my practice, we do have a dementia care specialty program, and we do engagement. We have an engagement specialist because post-COVID, we're finding that more and more people would like to stay at home if they could. And so if there is dementia and we're building a team around them, we also don't want to just look at care. We want to look at adding back in that joy of life and the programming and the structure. So we're also doing a lot of that as well. I want to add one other thing. There is a trend across the country of what we call solo agers, which are people who really do not have a support system. And they might not have a partner. Maybe they're estranged from their families, or families are on the other side of the country, and they're nervous. And so from a couple of trust and estate attorneys recently, and whenever, as you said, when you have your own practice, you can create things. And I see you doing that as well. I have a number of solo agers in my practice where we've put a plan in place and where they're backup. And we've made sure they have all their needed advanced directives and documents and support systems available for that what if, because they don't have that family system around them. And we're seeing that as a growing trend across the country. These are people who maybe are in their 70s, maybe even younger. They may not need full-blown care management services, but they do want those connections. So we've created a membership program that's very reasonable, where they can utilize us as that support system, even if they don't need too much right now. But I think as a group of care managers, 85% of our clients can have some form of cognitive impairment or neurodegenerative diseases. And when I've read your book, it just brings home to us that when we're out providing an evaluation to someone in their 60s and 70s, this is the opportunity to make sure that their hearing is corrected, or their vision is corrected, or that so many things that they're struggling with and they're finding challenging, we can get them to the right people. So that's really our mission.
Yeah, and I mean that's amazing, right? Because we don't as a public, right, as a community, as a society, I should say, we don't really have enough information on the best way to age. And we certainly don't have the time, right, to sit down with our primary care physician. We get about 7 minutes a year.
That's right.
Right? If things are going well. If not, maybe you get a little bit more time. But in general, there isn't this well-known opportunity to allow you to age the way you want to. And
Right.
and I don't remember the expression, but something like an ounce of prevention is worth way more than right?
Yeah.
Like it is so critical to understand how to stay in your home longer, how to avoid premature institutionalization or hospitalization, how to avoid a traumatic fall. There's so much to living your best life. I mean, I feel like the aging population now is even different than it was 20 years ago, where you got older, you retired, and you put on a house dress and you didn't do much. I mean, my 70 something year old mother is way more socially active than I am. And I feel like we're in a good place because we've started to put some of the pieces together for when or if something happens, as compared to afterwards. It's just, like you said, making a decision in a crisis is never an ideal way to go about that.
You just can't evaluate it at that point in time. It really, what happens is you lose so many options when you have to make a split-second decision. The other thing I think people find comforting is that we give them that deeper dive. If they, for example, go to an assisted living community, they see beautiful furniture, a lovely setting, but working with the care manager, you're starting to understand the real questions to ask that are going to make a difference, not when you first move in, but down the road when you've declined. Who is this facility and why, or how are they going to be able to meet my needs when my needs change? And so, as I said, it's an educational process to work with a professional similar to your field as well.
So what is, tell me, just as we wrap up here, where would I know that you're, at Symphony Care. Is there a website for that? And then, like I said, if somebody is in, Oklahoma listening or Utah, where would they go and find a nationally certified aging life care professional? Like,
oh my God. You did that perfect. Thank you. So Symphony Care Management is at www.symphonycaremanagement.com.
Okay.
That is where you'll find us. And we are in Metro West Boston, and we cover all of Greater Boston. I am always looking to be a resource to people and make sure they're connected, and happy to hear from people. If they are in other parts of the country, they're going to go to aginglifecare.org. That is our national association. Click on the yellow button that says find a care manager, put in your zip code, and all the nationally certified care managers will pop up. It's really important to ask a care manager how they run their practice. We're all small businesses. Some are small groups, some are larger groups. How they charge, what the terms are, because we're all different. But overall, it is a fee for service. We get paid for our time. And I think what's also important to understand is that you don't have to be wealthy to access this service, because oftentimes I'll get a call from a family member. Mom has been in assisted living. Her money's running out. We need to move her to a nursing home. We don't know what to do. There can be a small scope of work that we can assist with that will get mom to the best possible facility, because we're going to leverage our relationships that we have as credible professionals. And so I would say, don't ever rule out calling a care manager because you feel like you can't afford it, because we're going to make sure you get the help you need.
Sounds like no job is too big or too small. And I think that's really important to realize, that you can set up an entire roadmap, but you can also, if there is a time of need, you can find an aging life care professional to help you when you're in a pinch. And I think that just speaks to your level of empathy and expertise and willingness to help, even in, sort of a last minute scenario, although never, recommended that way.
Right. And if we can get to people sooner, and it really is about quality of life. Yeah.
Of course, right. Every survey that's ever been done in older adults, it's all about quality of life and it's all about independence. And
That's
the
right.
best way to do that is with some proper planning, right? The 5 P's to success: proper planning prevents poor performance. It's really that simple. Joan, thank you so much for your time today.
Thank you.
I know that people will go looking for you. I know that this has educated me. I look forward to passing this on to our patients. We will have links so people can go to your website. This will be posted across social media so that more and more people can access this great information that really we all need as we get older. So thank you so much for your time today.
Thank you so much for having me. It's great to speak with you, and also all the great work that you're doing to help people live their best lives. So thank you. Thanks for having me.